welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Clayton Corson. He's a medical student, and he wrote the Kevin MD article, Medical Students Are Benched During the Pandemic. Clayton, welcome to the show.
Yeah, pleasure to be here. Thanks for having me.
So we'll get into the article in a little bit, but first off, can you share a story and your journey to where you are today?
Sure, yeah. So I'm a final year medical student at the Creighton University School of Medicine. I grew up in a small town in rural Oregon. I've kind of bounced around the country. I went to undergrad at Colorado State University. I spent a year in North Carolina working as a toxicology researcher. And then I was accepted to medical school, spent a couple years in Nebraska, and now I'm here in Phoenix at the regional campus here. And I'm in my final year of medical school. I bounced around between a few different specialties, kind of what I wanted my life to look like. And I decided on emergency medicine and very excited to go forward and go from there.
All right. Best of luck to you.
Thank you.
So your third and fourth years typically has clinical rotations. How has the pandemic affected those?
We were effectively benched. I guess that kind of leads into my article, but 3 months ago, back in March, actually, there was a national kind of recommendation for medical students to be removed from the clinical environment. So that was back in March, and it lasted about 3 to 4 months. And so kind of that was the context surrounding the article that I wrote. And so things leading up to that, I was at home. It was a completely virtualized medical education. It was actually my second rotation back when I was scheduled to be in the ICU. And kind of the rules regarding patient care for medical students. We're not allowed to see COVID patients. We're not allowed to see patients under investigation. And I went into the ICU. I was very excited, especially as a rising emergency medicine resident. You learn a lot for sure. And our entire patient census was full of COVID patients. So effectively, after spending 3 months, kind of this virtual education in my mind, once again, I was kind of sent home, or I was sent to another rotation, and it worked out well, but it certainly was disappointing. It was frustrating. And I went home that day and basically wrote this article, a lot of reflection on just like what happened over the last few months leading up to that rotation, and also just kind of medical education as a whole. And so just breaking down my article, I kind of think it in the short term and also in the long term. I think in the short term, I think of in terms of the next 1 to 2 years, really how it affects our cohort. And basically, I'm concerned about our cohort's ability in a few different aspects. The first being just the ability to choose a specialty. Some rotations were outright canceled. Others were significantly affected by the pandemic in terms of clinical volume, in terms of elective procedures, for instance. And overall, I just think it's not nearly the capacity of what it was prior to the pandemic. So I think for some of my colleagues, not all of them, certainly not all of them, but for some of them, I think it is concerning being able to rotate on the different services. And of course, as that relates to physician burnout, career longevity, I think that's very important. Additionally, just in our ability to truly experience the clinical environment, I think that is something I'm also concerned about in terms of just like I said, the clinical census is down. Really, the rotations are suboptimal, and they are much better than they were a few months ago. But absolutely, it's something that's impacted our ability to learn from patients. And then lastly, just the actual educational quality through no fault of anyone or any institution, just the fact of a broadly changing clinical landscape. And faculty are overwhelmed. They have telemedicine, virtual health, a new clinical guidelines that change every single day. So all of the above, I really think in the short run, I'm not entirely sure how it will affect our cohort going forward. And I think we will do a good job of picking up the slack, but undoubtedly this COVID effect will certainly have a role in the years to come. And then I also think about it in terms of the broad term. That's something else I wrote about. Really, I was thinking about, 30 years ago, I'm not entirely sure that medical students would have been sidelined in the same way. In fact, I think they probably would have been enlisted or used and invaluable to the care team. And so I really thought about, well, what's changed? Like what has caused us to be to the point where we're essentially expendable and sent home in a pandemic? And I think there's a lot of different reasons, a lot of good reasons. There's a lot more ancillary staff, there's more rules regarding work hours and as that relates to like resident wellness. But at the same time, I think that comes at a cost to, in terms of patient education, patient care. And it concerns me in terms of looking forward to the next 10, 20 years. What is our class, what's our cohort going to look like in terms of our expertise and our ability to function in the same capacity as our, the people who came before us. And there's a lot of different reasons. It's a very complicated issue. I kind of boiled it down to two in my article, two of them being the medical kind of legal landscape. Like medical students are more so viewed as a liability nowadays, as opposed to maybe in the past, largely due to, a lot of reasons, but certainly medical legal is one of them. Additionally, just the capitalistic healthcare infrastructure that we work in, the bottom line, efficiency, productivity, it's no secret that learners and slow down the bottom line. And as a result, education suffers. And so when I was kind of reflecting and reviewing on this, I came across a great article called The Four Horsemen of the Medical Education Apocalypse, which is a dramatic title, but they make some great points. And this was written 12 years ago, kind of forecasting the challenges in medical education, including the medical legal environment, including the productivity and the kind of clinical landscape of capitalism. Additionally, increased class sizes, kind of expansion of mid-levels. All of these things kind of contribute to our education becoming more and more passive, which ultimately culminated in us being just completely removed from the clinical environment. I'm not entirely sure what the solutions are, and I'm not entirely sure how this is going to impact patient care. I was just trying to make an observation, and it's something that was frustrating. It's frustrating to go through 8 years, 4 years of undergraduate education and then multiple years of medical education to just be sent home, and that I really couldn't offer the help that I wanted to in that capacity. Yeah, I'm not entirely sure what the solution is, but it does concern me for my patients, for my colleagues. And I think I am an optimist. I do think, good things are happening, and there are always hardworking people everywhere. But yeah, I think it's just something to take note of and to be aware of as we go forward in our clinical landscape.
Sure. So here you are in your third year, and you were excited to do clinical rotations, seeing patients, going to the ICU, but you're at home and not able to do all of that. You talked a little bit about what was going through your mind, but how are you passing the time? How are you trying to learn about medicine, even while you're not seeing patients during that time?
Sure. So our curriculum was largely virtual at that time. So that was a lot of, it was almost similar to the preclinical years. It's such a huge achievement to finally get out of the books and into the wards. So in a sense, it was kind of like we were being sent back to that. But it was largely lectures. We also participated in telehealth, kind of academic conferences that were virtual. And then additionally, studying for boards. We still had to take our shelf exams. We still had to take our USMLEs. So that was the bulk of the clinical time, but there was still a large gap in terms of our ability to learn from patients, which I believe is the best way then the only way to really truly learn clinical medicine. And so kind of being sent back to the books, it was definitely a very frustrating thing. And there were other ways to help, through volunteer efforts and whatnot, but it still wasn't in the true capacity that I believe most students wanted to have to be able to use their training. There's a lot of considerations, and I think it was a very tough call for administrators to make this. I don't think they did not make it lightly. I think in certain aspects it was appropriate, but it definitely came at a price for us.
Now, if you were in charge of that decision making, what would you do?
Well, I think that it largely depends on the clinical need. How much of an emergency is it actually, the pandemic presenting? But I really think that it would have been valuable for students to stay on board from an educational aspect, from just having the foresight. These pandemics are definitely not confined to happening once in a career, certainly not. So just the educational aspect of being able to learn from a once in a century opportunity, I would have been for students staying. It was unfortunate that we didn't. I think there could have been ways to utilize us in the clinical realm. I do think that it was a challenge just because it's true. I mean, these were very hard decisions that needed to be made very quickly, and patient volumes were down. So if there aren't enough patients for medical students to see, do they really want us just sitting around? So I do absolutely appreciate how difficult of a challenge that was. But at the same time, I think there was a lot of valuable learning to be had. And I think that it wasn't taken advantage of in the right way.
Now, we're certainly not out of the woods yet. Just in Arizona, just a few months ago, there was a surge of cases, and there's no guarantee there won't be another surge. Tell me what the situation is like now. And if there's another surge in the coming months, do you envision medical students being sidelined again?
So it was kind of ironic, actually, that when we were initially benched back in March, the census was pretty low in terms of COVID patients. But then when we were brought back in the clinical environment, at least here in Phoenix, the cases were rising. So it was kind of ironic. We were out, and then as soon as we get back, the cases were rising again. Basically, right now, it's, a lot of, we wear a mask. We're restricted from seeing certain patients. We're not allowed to see like upper respiratory infections, or certainly people who are intubated in the ICU who have COVID. But overall, I think we've done a good job of kind of mitigating and being flexible in terms of what we're allowing students to see or to not see. And we are operating at a good capacity, I think, in terms of clinical volume, and in terms of our ability to see these patients. Now, however, I do think that it's not quite what it was back before the pandemic. I would probably say it's maybe 80%. We're able to see 80% of the patients that we used to see. It is a lot of PPE, wearing masks at all times, personal hygiene. But overall, we have in eye protection. That's been the new thing kind of in the last month or two. And overall, we have been able to see kind of get back into the realm. And I really wish that kind of would have been the case all along. I wish it didn't have to happen after months and months of debating and kind of figuring out what the best role for us was. But it has improved. And it's kind of the points I made earlier in terms of being able to choose a specialty, the rotation quality, that has improved, but it doesn't negate that we missed out on basically 4 months of that time.
Sure. We're talking to Clayton Corson. He's a medical student, and he wrote the Kevin MD article, Medical Students Are Benched During the Pandemic. Clayton, tell me what you've learned over the pandemic that you could share with the other medical students who may be listening to this podcast.
It was kind of a blessing and a curse, right? We were pulled from the rotations and pulled from our very demanding, studying all the time, working all the time. So in a certain sense, it was nice to kind of take a step back and really reflect on, your personal values, using that time for choosing, confirming the field that you went into, reaching out to mentors, participating in other capacities like research and whatnot. So yeah, I think in terms of that, it was helpful. But also I think, I definitely learned how much I truly, you don't realize what you love until you miss it, right? And I really learned that I truly love taking care of patients, especially, patients in the emergency department. It made me appreciate coming back into the clinical realm that much more. And that's something I think, students, most students reflected on that and thought the same, that, oh man, it really is a privilege to be able to take care of patients. Other lessons that I learned, absolutely keeping up with, studies, like keeping healthy habits in terms of like fitness and mindfulness and wellfulness and things of that nature. I think all the above kind of presented themselves, throughout the pandemic.
And my final question, do you have a take-home message that you want to share with the Kevin MD audience?
Basically, I just think medical schools and medical students, we need to take ownership over our education. We need to be good advocates for our patients. We need to be good advocates for ourselves. There's a lot of problems in healthcare, and they're never going to, fully go away. And as soon as they go away, new ones will come forth. So I just think it's a matter of identifying problems and where we can improve and just going from there. And I would absolutely advocate that medical students, should advocate for themselves, take ownership, and just go on to be leaders of their healthcare teams and profession.
Clayton, thank you so much for being on the show, and thanks again for your time.
Much appreciated. Pleasure to be here.